Our next speaker is Liz Murray. She worked as a physiotherapist and senior manager in the UK's NHS for 15 years before moving to work in the pharmaceutical and health commercial sectors for 25 years. So she has been supporting the work of the Lyme Resource Centre, Scotland, UK, and has lectured at a number of conferences on Lyme disease and the work of the LRC. So please welcome Liz Murray. Thank you.
Great. Thank you, Gordana, and thanks for the opportunity to speak today about our survey. I'm Liz Murray. Oops, and now I've got my first technical problem because my slides won't move. So let me just share them again. Okay, yeah. So in presenting to you today, I'm representing a team of colleagues you can see there who are involved in the survey and who are all also involved with the Lyme Resource Centre, which is a charity focused on educating the public and health professionals about ticks and Lyme disease. A bit about me, which Gordana has already covered. I'll let you have a read at that. But whilst you do, I'll tell you what is not there, which is that despite having a health professional background and as classic a presentation as you could expect to find, I got Lyme disease and spent 5.5 years working out what was wrong with me. And that journey has taken me to get involved with the charity today. In presenting our survey results, I'm going to start to, I think, put some shape around what a lot of us may know about Lyme disease, particularly diagnosis, treatment, and why greater awareness for public and health professionals really is essential if we are to, stop patient suffering. Let me start on how we got to our survey. And really, I should also give credit to Sharon that's just been presenting, because we did actually speak to her as part of this journey as well, although it's not highlighted here. But what got us to our survey was recognising a huge amount of data that there is on social media, online communities describing people's experiences and symptoms, and thinking about how we might capture it. And on that journey, one of the great things we did was we spoke to the CEO of MyLyme Data in the US. And, she really gave us great insight into their mindset associated with data. And whilst, they, as an organisation, now are very connected to academia, public health, government, really their beginnings were pretty humble in that they just started with some surveys. So really, as well as giving us lots of advice about how to proceed, she really encourages just to start and have a go, and almost said, having some data is better than having no data. So that really led to us creating and running our Lyme disease experience survey from February to early May 2024. The aim of the survey, as we described it, was to capture that real life experience of people with Lyme disease, so that we could begin to gather some data that might, start to inform some change. And that was really what we were trying to do. The method, really, the survey was online, and it was aimed at residents of UK and Ireland. It was promoted via social media channels, and we had great help from a lot of the other Lyme support organisations in the UK and Ireland who helped to share it. We were aware that people who have maybe had, let's say, relatively simple Lyme disease journeys may not have been involved in some of these online organisations. So we tried to get to some of those by asking other organisations to promote the survey. So these were organisations that were involved in the outdoors professionally, educationally, socially, like forestry, gardening, golf, those kind of things. So that was, how we went about doing it. And, I think the survey was not intended to represent all people with Lyme disease in the UK and Ireland, but the people that we were able to get responses from our survey. So in terms of results, probably important to highlight that there was a key screening question that we asked at the beginning of the survey, which was, have you been diagnosed with Lyme disease by a qualified health professional? This was really to help us get credibility with health professional audiences. And really, if the answer to that question was no, we excluded them from the analysis. So what you're about to see is analysis based on 475 people who answered yes to that question. I'm going to share aspects of Lyme disease awareness, diagnosis, treatment, and ongoing needs. To be honest, I'm probably just going to give you a flavour of what is in the survey today. There is a lot more available on our website if you want to look at it, including sort of regional subsets for Scotland, Ireland, and the UK, as well as people who were diagnosed under the age of 18. The other thing that we did was try to assess the extent to which some aspects of the NICE Guideline 95 for Lyme disease, which is UK only, were put into place as part of people's Lyme disease journey. So much of this will probably, as I say, not be a surprise, but I think it does start to quantify things a bit. So on awareness, I'll start at the bottom right-hand corner in a logical way, which is really kind of highlighting that around 2/3 of people, the respondents, were neither aware of the need to protect against ticks or were aware of Lyme disease prior to their illness. And also, I think the other kind of big message for us around awareness is really in the two charts here, which is that the respondents were really involved in everyday activities, whether it's hobbies, work, or whatever, and were in relatively common locations when they had their tick bites. So I think the kind of key message from this is that awareness of tickness and Lyme disease was low before people became ill, but actually they were doing a lot of everyday things when they got their tick bite. And probably of particular note was a large number didn't recall a tick bite or were not entirely sure where they were bitten. And that around a quarter identified that their bites occurred in what we probably call more kind of urban environments, whether that was a park in their garden or the indoors environment as well. So that's some highlights on awareness. On diagnosis, I think whilst prompt diagnosis and treatment gives the best chance of recovery from Lyme disease, I think our respondents highlighted delays in diagnosis. So the bar chart in the bottom left-hand corner there shows the time interval from onset of symptoms to diagnosis for all our respondents. And you can see for over just around a quarter of them, it took them over 5 years to get that diagnosis. About just under 2/3 of them had an EM rash, but only 20% were diagnosed within 4 weeks of symptoms and less than a third within 3 months of symptoms. And interestingly, for 3/4 of them, the suspicion of Lyme disease was not made by a medical professional, but was made by themselves or their family, friends or colleagues. Also in diagnosis, we identified over 20 different medical specialties involved with respondents' Lyme-related symptoms. And we also asked the question of the respondents of, what other types of either incorrect diagnoses or medical conditions were suggested to them prior to the Lyme diagnosis. And you can see the word cloud here of the sorts of conditions that they were either diagnosed with or were suggested to them. Probably not a surprise to people who are, closely involved in this area: chronic fatigue syndrome, ME, depression, fibromyalgia, anxiety, as well as, numerous neurological and rheumatological potential diagnoses. So that's a snapshot of the diagnosis picture. When we look at treatment, again, assuming early treatment gives the best chance of recovery. The bar chart at the bottom here highlights the time from symptoms to first antibiotics for those that got antibiotics, which was 90% of the respondents. So you can see, delays for lots of them, and for, just over a third of them, it took them over 2 years to get an antibiotic from their symptoms. And again, of those who had antibiotics, you're talking about just over a quarter getting within 4 weeks and 38% within 3 months. And not surprisingly, 86% saying that they did not fully recover after their first antibiotic. Also on treatment, we asked people whether or not they had fully recovered from Lyme disease. and only 18% said that they had. 81% they said they'd been unwell with Lyme disease for a year or more. And we also asked them if they had difficulty accessing treatment. 78%, and of those who said that they did have difficulty accessing treatment, 78% said that lack of disease awareness and expertise amongst health professionals was a top barrier to them getting their treatment. In the UK, we have a guideline for the treatment and diagnosis of Lyme disease called NICE Guideline 95, which was launched in April 2018. We didn't design the survey to assess its application, but we were able to retrospectively look at some key elements of that for the 100 respondents that fit the category of being diagnosed after the guideline was launched and were treated within the UK's health system. And really, just a few highlights on what we were able to pull out there was things like, 50 respondents who had an EM rash also had a Lyme disease blood test when perhaps they didn't need to have it. And that, of those 73 in total who had blood tests, with 48 of those, only 48 of those tests being positive. And some insights around antibiotics, perhaps nothing particular of note here, which apart from the things that I'm going to go on to describe on the next slide, except to say, I think with a guideline, we probably wouldn't expect 100% compliance, but it would be good to see that, as much correlation with what is being asked as possible. Where it does start to get interesting on antibiotics is around people who did not fully recover after the first antibiotic. So of 77 of the did not fully recover after the first antibiotics, but only 49 were prescribed further antibiotics. And of those 49, 14 of them were prescribed the same antibiotic when the guideline is very specifically says that they should have an alternative antibiotic to their initial course. And if those of you that are adding up the 30 and the 49 and saying they don't add up to 77, is because 2 patients did say they'd fully recovered but still managed to get a course of a second course of antibiotics. And then in terms of the outcome, of the 99 respondents who got antibiotics, only 22 fully recovered after the first lot, and only 26 say they're fully recovered, 73 say they're not now fully recovered. So I think the point with this was really to highlight that even where there is a guideline in place, it doesn't necessarily mean that people are going to get the right treatment. Moving on to ongoing problems, it was interesting to see Sharon share some of this in her presentation as well. So we had 83% of our respondents said they had ongoing symptoms. You can see there the most common symptoms and their severity, rated from mild, moderate to severe. Probably not a surprise to see things like fatigue, brain fog, joint pain, sleep problems, muscle aches, anxiety, depression being some of the key things that are in there. And, sadly, over half of our respondents said that they had been unwell for over 6 years. And not surprisingly, those sort of symptoms spill over into everyday function. So 80% of respondents agreed or strongly agreed that they function sort of less well than they did before their illness. You can see that on the chart here. We did actually ask them if they disagreed, but obviously that was only 20% of all the answers in each category. And then we also asked them other ways that Lyme disease had affected them. And you can see here, significant percentages saying it affected their social life, hobbies, financial, again flagged by Sharon in her presentation, affecting relationships, career consequences, education, etc., etc. So, really some really significant impact, which I think is very nicely summarised by the quote at the bottom of the page here. And in actual fact, in the survey, we did provide respondents with the opportunity to describe in their own words how Lyme had affected them. And here's a small selection of some of those descriptions. Quite heartbreaking to read some of them, really, and really reinforces the life-changing consequences that can occur from miss or delayed diagnosis of Lyme disease. So a few short discussion points, a lot of people not aware of the risks of Lyme disease, about it, about the bites occurring in everyday places. There was another Lyme disease experience survey carried out by Fagan and colleagues that was published in 2023. They interestingly flagged that, one of the objections they commonly heard was patients saying they were told by health professionals they couldn't have Lyme disease because there's no ticks or Lyme disease in their area, when actually, I think we can highlight that they're occurring in everyday places, and that, this issue about expertise among health professionals being a significant barrier. Diagnosis, obviously early diagnosis gives the best chance of cure. I think it's clear that certainly in the patients that responded to our survey, that a diagnosis was delayed and health professionals were not considering Lyme disease early enough, and were applying other labels or conditions when they weren't able to get an easy answer to what the problem was. Practical things like people being tested when they didn't need to in relation to the NICE guideline. And then the Fagan and colleagues also highlighted, they did an assessment of a median number of doctors that patients saw before diagnosis. We didn't do that per patient, but we did do it. We did identify a significant broad range of medical specialties who were being involved with patients and their symptoms. Treatment, again, 80% had difficulty or more than 80% had difficulty accessing treatment. Just 28% got treatment within a month, and for almost half it took over a year. 86% not recovering after the first antibiotic. And even where there is a guideline around antibiotics, there's some discrepancy around how that was applied. And then finally, over half people being unwell for 6 years, significant number having ongoing symptoms, which we've flagged and I'm sure are familiar to the audience, are really 80% agreeing how it's affected their day-to-day functioning and made them much less productive and having a big impact on their lifestyle. Sharon talked about selling her home. We had similar stories of people selling their homes and making very significant decisions to help them try to find a solution to their health problems. So I think whilst there may be individuals who quickly, correctly, successfully get diagnosed and treated for Lyme disease, this is obviously not the case for many, and they suffer greatly, often for long periods of time, unable to make full recovery and live with significant health issues that impact their overall lifestyle. So I think really just hopefully puts a bit of shape around some of the things that we know, but above all highlights the need for ongoing greater awareness and education for the public on how to minimise risk, as well as for health professionals to ensure prompt diagnosis and adequate treatment for Lyme disease. A few quick limitations on our survey. As I said before, it's not intended to represent everyone. We did try and reach people who may not have been online. People who are undiagnosed with Lyme disease were not represented in the survey because of that screening question that we had. And just out of interest, the ethnic diversity of the survey was 98% white. We talked about why that might be the case without coming to any conclusion, except at one end of the spectrum, perhaps there was, less people with darker skins involved in some of the online forums, all the way through to, erythema migrans being difficult to detect on darker skins. So really, hopefully, that has given you a little bit of insight, has added to the session and discussion on data, has highlighted the lived experience of people who, in particular, have not been promptly diagnosed and treated, and highlights the consequence that can ensue, along with the socioeconomic effects that can have in its broadest sense. If you go to our website, lymeresourcecentre.com, there is a page dedicated to the survey where you can access some of the information that I've shown, as well as lots more subsets. And we're very welcome to answer questions about it through the by emailing the charity, as well as taking questions now, and some of the references that we've used throughout the session. So I think that's me.
Thank you very much, Liz. Thank you so much for presenting. We are now going to look at questions. So firstly, from the room, here is one.
Thank you, Liz. This is Leona Gilbert speaking. You can't see me, but hi. So really thank you for your presentation in regards to all the statistics and the data. So where do you go from here with this data? What are you going to do with it?
Go ahead. Sorry, did I what's in before you'd finished there?
My last was, where are you going to go with the data and how can we help you with that journey?
Yeah. So the it is the survey is on our website. If you go to our website and click on the survey, it'll actually take you to Cambridge University's One Health portal. So the data is available with a DOI number attached to each of the different types of survey. So, I'd say to anybody to look at it, use it, quote it. If you've got any questions about the specifics of the data, come back to us. Maybe there's something in it that you want to know that we can go back and have a look and see if we can pull out further data. And I think it has also served as a potential pilot for some further work. So I know, within the team, we're thinking about where we go from here and what else we might do by way of follow-up. And I also know that, of some colleagues who are looking at maybe a kind of scientific sort of more multi-country version of something similar.
Okay, so I have a question.
Okay.
So this is Kunal Garg from Tezted. Great statistics. My question is regarding the inclusion criteria and exclusion criteria. So you've excluded patients that were not diagnosed for Lyme by a physician. Did you have any other exclusion criteria like previous illnesses that they were diagnosed? Because how they rate whether feeling well or unwell would skew that data to a certain extent.
Yeah, good question. I mean, we didn't specifically ask about that, but I think there was an open question where they could have highlighted that if they felt it was having a significant impact on their answers. But yeah, I mean, I think it's a fair point. We didn't ask necessarily about pre-existing illnesses.
Great, thank you. We have a question from online. Ignacio, how to distinguish local infections from imported ones, considering diagnostic delays, current globalization, and ongoing immigration flows?
Yeah, I mean, a great question, but probably one that we didn't cover within our survey, to be honest. I think apart from asking whether or not they've been diagnosed with a professional, we did ask questions about testing, but we didn't ask anything about types of infections. The only, I think, answer to that question I might have was, I think, the point about people being getting their getting Lyme disease overseas. So yeah, 27% kind of didn't get their Lyme disease in the UK or Ireland, they got it overseas.